Everyone, I wanted to real quick kind of go over how an HRA works, or a health reimbursement account. And this is something that you can easily find on any other YouTube channel, but I wanted to kind of break it down. So a health reimbursement account is basically your employer deciding that they're going to cover part of your healthcare costs, whether that is towards your medical insurance plan, your dental plan. There's a variety of different things that it can go to, and that's going to depend on how it was structured at the employer level, right, at the company level. Now, a lot of times when we're working with clients and companies, we'll help them structure an HRA. And a lot of times we're going to line it up with how your health insurance plan works. So, for example, let's pretend that a client of ours, a company, offered this AmeriHealth plan. And previously they had a plan that didn't have a deductible. Well, obviously, with the rising healthcare costs, they want to make sure that their employees are taken care of, but at the same time that they're not wasting dollars on healthcare premiums for a plan that not everyone might be utilizing. So what they could do is they could say, hey, we're going to offer this AmeriHealth plan, or it could be an Aetna plan. It could be either or, but maybe that plan has a deductible now, right? Or a higher deductible than you're used to. So in this case, let's pretend again that they previously had a healthcare insurance plan that had $0 deductibles. Well, maybe they're going to offer this plan, and then they're going to say to their employees, hey, John, hey, Jane, you now have a $1,600 deductible, right? However, what the company is going to do is we're going to reimburse you that deductible. And so what that does is it kind of makes it how it was prior, right? When you didn't have a deductible. But now your company, your employer, is taking on that risk, right? As opposed to the insurance carrier. Now, the difference here, and the reason why your employer might be looking at something like this, is if they don't think that everyone's going to utilize their deductible, well, now they at least get to keep the money in their business bank account and help fund bonuses or other benefit programs, paying for your salaries, etc., as opposed to the insurance company. Whereas if the insurance company held on to it, it's not like they're going to send that money back saying, hey guys, thanks for not using the insurance. So using an HRA, or health reimbursement account, is a creative way for employers and companies to try to keep benefits in line for their employees while taking on the risk themselves. Again, depending on how the plan is structured, you as the employee or individual may not notice any difference. And that's just simply because, again, prior you had no deductible, where maybe AmeriHealth or Aetna, again, they were absorbing all the costs up front, whereas here that cost is being absorbed by your employer. Now, which company they go to monitor or manage that health reimbursement account is going to vary. They're most likely going to be using a third party, which is going to allow them to submit the claims and get all your bills and everything like that reconciled so that you're not holding the bag. And again, that's something that you're just going to want to talk to your employer on in terms of what that standard procedure is for getting this deductible reimbursed. Because, again, if we're going to look at Peg having a baby, well, AmeriHealth or whatever insurance company thinks that I'm responsible for my first 1,600. And so based on this plan, right, you can see that the benefits are pretty rich outside of that deductible of having 1,600. So if my employer is going to reimburse that 1,600, I as the employee just need to figure out how to go about getting that reimbursement so that I can have, minimal costs. We hope this was helpful when it comes to learning how a HRA, or health reimbursement account, works. But as I mentioned earlier on, it's really going to depend on how it was structured within your company. See you soon.